Good day, everyone. This is the Group 8 presentation, and the module title is Global Operation. The course code for today's presentation is 7044 SSL, and our title, our subject title is the National Health Service Sector. Now, before I start, I would like to introduce every member of my team. I'll start from myself. My name is Patience Juanita Okafor. I have with me Omowumi Comfort Joseph. I also have Evans Osahan Igbenovia. Sorry if I made a mistake. And I also have with me Adisa Boladale Taufik. And I will go to my first slide by introducing the overview of the lean production in NHS. Now, this slide will be systematically explained as the approach to reduce and to improve the process of the increased productivity. It is originated in Japan during the World War II and include concepts such as the just-in-time and the casing. Now, the casing is also known as the Kanban, and the casing, they are similar. Like I said, the casing is the concept of continuous making small improvements in processes, goods, and services, resulting to long-term goals, benefits, and the ability to identify or to solve problems effectively in the organization. While the JIT, which is the just-in-time production, this has to do with the works by organizing production process and deliver products or concepts precisely, like components precisely, to deliver it to the customers when necessarily, by eliminating the need for excessive inventory. Now, in the diagram, it shows how this work from the customer place of order to the manufacturer ordering the material required, to the suppliers, to the manufacturers, and back to the customer receiving the product. Now, what this means is it involves a close coordination between the supplier, the deliverer, and the customer in terms of the materials and the parts on time, in getting their items on time, in everyone doing their part on time, by minimizing the storage on time, and by reducing the cost and waste, which means the JIT help in increasing efficiency and decreasing waste. At this point, I would like to introduce the next slide to my colleague.
Thank you, Juanita. Lean principles in healthcare focus on maximizing value for the patient by eliminating waste and improving efficiency in healthcare processes. This involves understanding that patient's perspective, optimizing the value stream, ensuring smooth workflow, matching patient's demand, and continually striving for perfection. Implementing these principles can lead to significant improvements in patient care and administrative procedures. Next slide is a picture representation of what I spoke about. Next is an overview of the National Health Service. The NHS is a publicly funded healthcare system in the United Kingdom that offers free medical treatment to all residents. Talking about the importance and scope of the NHS in the United Kingdom, the NHS is considered a model for equal and accessible healthcare in the United Kingdom and worldwide. It provides universal coverage, ensuring that every citizen has access to healthcare regardless of their financial situation. The NHS offers a wide range of medical services, including primary care, specialized care, surgery, emergency care, and community care through hospitals and clinics. Next slide. The NHS in the UK is one of the largest employers in the world, with a significant workforce of doctors, nurses, allied healthcare professionals, and support staffs. The government provides a high budget for the NHS, funded by taxes and government monies, reflecting its commitment to healthcare. This financial support enables the NHS to effectively address the healthcare needs of the population. I'll be handing over to Omowumi.
I will be talking about the SWOT analysis of NHS. The healthcare strategy has several strengths, including its established system, commitment to patient care, and history of research and innovation. However, it also faces weaknesses such as resource constraints and resistance to change. There are opportunities in advancements in healthcare technology and patient-centered care, but threats include increasing healthcare demand and competition from private providers worldwide. Concepts. The NHS has benefited from adopting lean concepts by centering care around patients, saving costs through resource allocations, and improving the quality of healthcare services through continuous improvements. This has led to more positive and effective healthcare experience, long-term sustainability, and improved patient outcome. Whereas the process of them adopting lean, it has led to improved customers, improved patient outcome, and long-term sustainability. They were able to sustain a lot of things and improve the outcome of their patients by reducing the wait time and so on. The next slide explains the challenges in implementing lean in healthcare. Implementing lean principles and methodologies in healthcare facilities can be challenging due to various factors like strict regulations and compliance. Standards in the healthcare industry require careful maneuvering of adapts lean practice while adhering to the constraints. Additionally, protecting patient data privacy and abiding by the laws like HIPAA may require adjustments to data management and sharing practice. Research constraints such as limited personnel time and equipment can also impact the speed and extent of lean adaptations. Hospitals may need to rearrange work schedules, like changing the time their work routine, the shift of the staffs, and or provide additional training to successfully manage this limitation during the implementation. That is why they are implementing the lean process. They will need to change most of their times, the routine of the staffs, like the nurses on duty, the doctors on duty. They will have to change a lot about their time and provide additional training for the successful of the for successfully managing this limitation during the implementation. The next slide still continues to shed more light on the challenges. In the healthcare industry, there is often resistance to change due to the implementation placed on patient care. Healthcare professionals may be resistant to adopting lean principles if it disrupts their established routines. Lastly on our list, the complex workflow in healthcare, such as those in emergency room, require extensive process mapping and optimizing to implement lean successfully. Thank you so much. I'll be handing over to Osal.
I'll be throwing light on the best practices for lean implementation in the NHS. Implementing lean in the NHS requires a well-planned strategy, including top-level leadership commitments, engaging frontline staff, value stream mapping, continuous training, and utilizing data analytics, and starting with small-scale pilot projects to test and refine lean techniques. These practices ensure effective implementation, process improvement, and healthcare transformation challenges. To effectively address the challenges of implementing lean in the NHS, strategies such as effective change management techniques, engaging all parties, involved gradual adaptation, data-driven decision, encouraging a culture of improvement, and mitigating opposition and resource limitations are crucial. These strategies aim to ensure a smooth transition, maintain patient care, demonstrate the benefit of lean, and resolve any obstacles that may arise successfully. Lean initiative in healthcare, specifically within the NHS, have led to the reduced patient wait time in the emergency department, streamlined administrative process, enhanced surgical efficiency, and improved patient satisfaction. These successes have been achieved through the process optimization, improve resources allocation effectiveness, patient registration, and billing procedures, and all the implementation of lean practices such as improve communication between surgical team and reduce surgical mistake. At this point, I'll be handing over to Juanita, patient. Thank you.
Conclusion, like my colleagues have all said, I will just be giving the concluding part, which in conclusion, the lean healthcare is a systematic strategy that reduces waste and seamless operations, and it also improves the effectiveness of the NHS system. Now, implementing the lean can lead to improvement of patient care. It can lead to the cost reduction and also an higher standard of excellence. The NHS in the UK has a great example of the lean implementation, as my colleagues have said previously, which is as a means of showcasing how it can lead to efficient advancement, how it can bring growth to the organization, and how it can advance the organization. However, there are challenges to implement. Like, there are so many challenges while implementing the lean system in the healthcare, such as the resources, the constant of resistance of changes. Things might come up and things might not come up, which those are the basic challenges, what they will do, how they will do it, and the outcome of it. Now, while the success story of this healthcare, it demonstrates the transformative power of lean, from reducing the patterns, reducing the time waiting of the patient, reducing the cost, and reducing the expenses of the patient. Now, these are the significant part of it. And also, don't forget, we have the surgical effectiveness, which will also be enhanced. Now, at this point, I would like to end this note here and go to the references. Thank you very much for your time and hope you enjoyed the video. Do have a nice day. Thank you.